Welcome, my dear students, back. Welcome in another part of the rules of the personal support worker and the health caregiver and with the dementia cases, how it looks like and how he would be acting with the dementia cases. We'll go right now into the second part. Probably it will be like here. Let's go like this. I just want to get closer to the here. We will start right now another part. We talked before on the previous pages about things which had to be understood by the rule of the personal support worker. We said quickly how to talk to the patient. He must learn how to talk to the patient in a good way, notice triggers and agitate, upsets patients and remove them. And that's what we will discuss in a private chapter here, how to deal in a smooth and a gentle way with the dementia cases as a personal support worker, how you will do this. He must have communicating strategies also and do things that remind patients where she is and what she's doing right now. Remember, patients may not understand the words, but they sense they have the expressions and they have moods. So be enthusiastic while you are working with them. Be passionate. Be very passionate when you work with the cases. Use routines like you see here. Stimulate them to the extent that they find enriching. The word validation, we said the validation means what? When patients get agitated, say wrong things, complain or say something, understand the underlying reasons and address it. So if they scold or abuse or do aggressive behavior, don't take it in person because they are mentally, there's something is not completed with them. So be very patient with them, be compromising, know that there is a reason they are doing this, and don't take it in person or don't return your behavior to be aggressive as well. These are some points which you have to know. And then we talk also about help patients stay oriented with their surroundings, like tell them what's surrounding them and so on. Adjust environment to make it less threatening. So the environment around them not to be threatening. Then we go also into the focus on things that can harm patients and remove it. Remove it, as example, scissors, knives or whatever, blades, razors, all these things should move it from their ways. Use knowledge of patients, the activity that triggered behavior, the environment, the type of communication, and the state of the patient and health, patient health to do this. So in all the cases, be very passionate. As a PSW, you have to be very passionate, and you have also to be very compromising for their own behavior, and very understanding and tolerate. You have to tolerate any aggressive behavior. Use creativity to define and implement a strategy. Check effectiveness of strategy and fine-tune it. So for supporting the clients with dementia, first thing, their basic needs, the food, the water, and so on. Keep fluids also always beside them, whatever you can. Keep them always hydrated. Meet food and fluid needs, so the intakes of them, and so on. Provide skincare and keep skin free for urine and stools. So when they eliminate, just be there to help them to do perineal care, promote personal hygiene, but not force the client into a shower. Also, we said this, the right of autonomy or the right of the patient into the right of the patient that we respect his choice. So if he tell you, no, I don't want shower, then it's okay. Don't do shower for him. And also, what kind of shower he like to do? He like to do the bath shower or the bed shower or a towel shower, whatever kind of shower. So you have to help him also here. Provide oral hygiene. Also choose clothing that are comfortable to them. Have equipment ready to procedures. Don't give complicated clothes or wares or whatever. Very easy things. Observe for signs and symptoms of health problems if there is. Safety procedures for dementia patients. Remove harmful sharp things like we said, knives, dishes, razors, and so on. Glasses. You can also substitute this with plastic cups or the cups which can is okay with to use it with the hot drinks and so on, so that will not do them harm. Place safety plugs into electrical outlets. Remove electrical appliances and the cords and the hair dryers and the curling and the flat iron and curling iron as well. Makeup mirrors, all these removed from the ways. Store household cleaners and medication in locked storage areas. Supervise the client when the client smoke. Be watching him when he's smoking. He might hurt himself and he doesn't know or he forgot. So be there while he's smoking as well to supervise him. Okay, we'll move into another point right now regarding the clients. Here we go. The hygiene and grooming and dressing, we said also to help with the hand washing. So we help the client with his hand washing. And we also help him to wash, to clean himself when he's urinated or defecated, or cough or sneeze or blown the nose or handle the eaten food, and his hand becomes silent. Help him in his elimination needs. The clients with moderate and severe dementia may urinate in the wrong places, so you have to help them and clean them. The nutrition, based on the plan, client with dementia may become distracted during meals, or it may be hard for them to sit long enough to eat meals. Client may be able to eat small amounts, so just cut into small pieces, even also to avoid dysphagia, as well. The fluids, client with moderate and severe dementia are at risk of hydration, and they do not recognize thirst. Encourage them to drink fluids regularly and so on. Exercises. It is important for the client with dementia, but they may resist it because they don't understand what's happening to them. So for the exercises, because they might feel it's harm, so that's better thing, or that might agitate them as well. So don't force. If you see that they are not happy with the exercises, like range of motions, exercises or so on, don't do it and just notify your supervisor that he's not willing or she's not willing or not accepting to do the exercises, and she's not okay with exercises, and see what they will tell you. Comfort. The PSW must make sure that the client is physically comfortable. A quiet environment, taking a calm voice, massage, soothing touch, music, and aromatherapy are all comforting environment and relaxing. Sleeping. You will help the client to sleep. As a PSW, you encourage the environment which will help him to sleep more. So as example, follow bedtime rituals. Use night lights, which will help in accident, to prevent accidents and so on. So the night lights is there. Don't put it for him totally dark. No, just keep some lights so that if you want to wake up and walk, go to the washroom or whatever, then he might not be tripped or slipped in something, or and he might break his leg or feet or whatever. So take care of this. Limit is caffeine intaking, because too much caffeine, like drinking too much coffee and too much tea, will make him alert, and he will not be able to sleep. In that case. He will not be able to sleep. So make sure of this as well. Discourage naps during the days. Naps during the day will make him awake at night. So don't allow him or don't allow her to sleep too much within the daytime. Discourage this. Encourage exercises during the days. But like we said, if he's agitated or having he's aggressive or he's not comfortable, not happy with the exercises, then you have to stop it in that case and report this to your supervisor or to the nurse or the nurse. Reduce noises also, this one. Okay, that is regarding the some points like the sundowning. Also, one of the points which we want to know is the sundowning. What is the sundowning? Sundowning means change in the behavior of the dementia patients. There's happen a change in their behaviors. In the nighttime, they become very aggressive. And it happened to me personally. This case happened to me personally. Was one of the cases. And he used to get at night, he used to get very angry and scolding and shouting, abusing everyone around him. It is a condition in which the signs, symptoms, and behavior of dementia increase during the hours of darkness in the late afternoon and evening hours. So in both, in the late afternoon and in the evening hours. This happened also in both of them. Like say, as daylight ends and darkness sets in, disorientation and restlessness will start, anxiety, agitation, and other symptoms increase. It increase only on the nighttime. Behavior worsen, the behavior will get worsened and more aggressive in this case. The client may be afraid of dark or may see things. He may also see things that may see things that are not there because of poor lighting or the shadows. If the client tell you, for example, there is a strange person in the room, you should never ignore the client's statement. So don't make like pretend that you didn't hear him. No. So turn the lights on and assure the client, reassure the client. So turn the light on and show him that there is no one. Remove things that may be casting a shadow or disturbing the client and provide the client with verbal reassurance. These are the things which I want you to know here in this point. And we said, discuss the personal support worker rule with dementia cases or with dementia patients. Discuss the PSW rule with the dementia cases. We'll move now to a new part as a support strategy. We'll move into a new part, support strategies for personal support workers, early stage of dementia. Like we said, most of the textbooks divide the stages of dementia into 3 stages: the early stage, the mid stage, and the late stage. So we'll go for the stages one by one and take them and discuss about them one by one here in this topic right now. So the first part will be the role of the PSW or personal support worker with the first stage or the early stage of dementia, in the early stage of dementia. So in the early stage of dementia, the mental abilities, like you see here, there is mild forgetfulness. There's little bit not too much, but there's still some forgetfulness. Forgetting recent events. So the forgetting here in the recent events. Difficulty learning new things and following conversation. Difficulty getting lost or not following directions. In communication also, there's little bit difficulties finding words. Sometimes the words of things which he used to do, he forgot, like what said before. Occasional disorientation to persons, time, and place. Difficulty performing everyday tasks, like here. We have also poor judgment, bad decisions, including when driving. So all these things, what we have to do to, as a personal support worker, what will be your strategies to help that? As example, for the forgetfulness, use labels, notes, calendars, alarms, pill dispensers, and this may assist with remembering. So things that might assist with remembering. You know, the early stage, still the memory is there. But there is a little bit change in the memory function. It's a little bit dysfunctioned. So in that case, use things like, as example, the calendars, alarms, which help him, pill dispenser, and visitors. Those all might help in remembering when to take the medication, when the patient will be able to take his medication. Difficulty learning new things, difficulty and following conversation. Sometimes they are very slow down, and you have to deal with this also. Also, post emergency numbers by the telephone so that they are easy to see. So as example, emergency numbers, put it by the telephone. Break tasks into small steps. So don't put a task as a whole step. No, break it into small steps. Keep groups sizes small to reduce noise. Encourage the client to engage in conversation. It's all a matter of slow down in everything. For that reason, you have also the main target, you have to divide it into sub-targets or small targets. Ask the client short questions, ask questions frequently. So ask the client, are you okay? Are you okay? Are you hungry? Are you hungry? Don't say, are you hungry and thirsty and you feel cold? No, just one part, a small, short question, and repeat it. Short question and repeat this question. Short question and repeat this question. Have some escorts the clients to doctor's appointments. You also have to do this. Take the doctor to his appointments. Register the client with the Alzheimer's Society. Medic alert safely home registry. The family should discourage the client from driving and offer to drive the client to a destination if needed. So in that case, it's not preferable in the early stages of dementia. It's not preferable in the early stages of dementia that the client can drive. It's not preferable. A client should not drive on these early stages. No. Family can take or carry on this responsibility instead of the client himself or the dementia patient. By the client here, the dementia patient. So these are the things which should be done on the early stage. On the early stage. Also, you will find there is blaming others for mistakes, forgetfulness, and other issues. Mood shifts. Mood shifts means is moving in between a good temper into a bad temper, or from an easy-going person into a very hard, stiff, rude person. Especially like we said, when the sun downing. This is also another point. When the sun is downing, this is a sundown. This change in the behavior happened with the cases of dementia as well. Symptoms of depression, irritability, or defensiveness, that's also appear. Lack of spontaneity, less outgoing or less interested in things. The patient is not care anymore, does not have any interest anymore. He has no interest anymore in things like his hobbies, things which he was interested in the past, watching TV. It doesn't matter for him too much. You'll find also one of the symptoms in the early stages, positive withdrawal from usual activities, then restless as well. Right. My own strategy as a PSW to deal with these situations is what? Encourage nutrition foods, like we said, nutrition and hydration as well. The water, the fluids. The fluids intake is very important as well. Allow the client to verbalize through the feelings, encourage meditation, or stress relieving activities, things which can release the stress, meditation or exercise, any other exercises. Encourage the client here is the patient, to stay physically fit, social connectedness with family and friends. Participate in activities that brings meanings and pleasure to the client in that case. Also, encourage the use of safety features like handrails and grab bars on the stairs. So let him use it. As example is going upstairs, let him support on the handrails. Remove tripping hazards from home, like we said before, things which leads to risk, like scissors, knives, razors, blades, glasses. It might be broken and he might hold it with his hand or something, the broken part. So take care of all this. Try to let him avoid it and try to let him not to try to let him not to do, but and also put the lightings like what we said before with the lights is using a night light so he will not tremble or he will not fall or she will not fall while they are walking, going to the bathroom or whatever. So these are the early stages strategies which is used. We talk about the symptoms of the early stages of dementia. We talk about the symptoms and we talk also about how to deal with these symptoms. We will go to watch right now a video about the early stages of PSW strategies. For early stages of dementia. We'll look for a small video that we'll watch it right now about this topic. Let's see how to deal with a client in the early stages of dementia. I'll just choose this one here, recognizing the early stages of dementia.
Yeah, that's
Let's go and see.
lost. I ended up calling my wife saying, I don't know where the heck I am. Fuck. When I left the house, I went to church and I had my clothes inside out. I didn't see it at all. My memory just blanks out.
If you picture a Christmas tree with lights, one starts to flicker a little bit. And you go over and you tap it and it goes back on. But then eventually that one that was flickering doesn't go on anymore. To me, that's what dementia is like. Dementia is an umbrella that covers many, many different types of cognitive impairments of brain diseases. Your memory changes, your emotion changes, personality changes. And then you start with confusion and disorientation.
For us to finally get the diagnosis took about a year and a half. Process of elimination. Is it depression? Is it Lyme disease? An infection in the brain? You don't know what the heck is wrong with you, but you know something's wrong. When I got diagnosed, it felt like someone had punched me in the gut. Literally, it just overwhelmed me. I went through a horrible depression, thinking life is over for me. I'm sorry. The last thing on my mind was that I'd be dealing with what I'm dealing with right now. I would do anything to go back to that time. I'm not the same person I was.
There is no proof that any medication will slow down dementia. There are many research drugs out there. There's no proof that any of them are doing anything. There's no hope for a cure right now, but there is hope. There is hope.
Nobody wakes up the day after they get a diagnosis and all of a sudden they're end stage. This disease is a progression. Just because I have dementia doesn't mean that my life is over or that I don't want to contribute to my community, society in general, or especially my family.
Maybe I can't do everything I used to do the same way, but I can still do a lot. But we have to figure out how to do them differently, which means figuring out how to overcome the obstacles.
When you come to a bump in the road in your life, you have two choices. You can either move forward or you can stay stuck. I realized that I still was a valuable person. Get your ass up out of bed and live.
I'm trying as hard as I can, living a meaningful, purposeful life.
I don't want just to survive dementia. I want to thrive. I want those happy times to continue as long as they can.
That was about the early stages of dementia, and it show a little bit description about the feelings and emotions of the people who has the dementia in the first stages. I'll just now go into questioning here, and I will say regarding the early stage of dementia. Copy, and I will take a question and go into the slides, our slides, and we discussed here the strategies of the PSW to deal with the early stages of dementia. That's why I would say right now, here we will go to sign. Just 1 second, guys. Sign. And here we will comment the background, hide the sold, apply to all. Then here, my question will be like this. What are or or discuss the symptoms of early stage dementia. This is the first question. Then discuss what a PSW strategy to cope with this case. So what is the early stage dementia, the symptoms, and what is the PSW strategy to deal with this case? How the PSW will deal with this case? This is the question right now. And I will wait here a few minutes, guys, to get your answers for this question. Here it is. This is the question again. And here is our question. Discuss the symptoms of early stage dementia. Then discuss what a PSW strategy, what the strategy the PSW should conduct to deal with such a case. We'll stop here like around 5 minutes to collect your answers on this question. We will stop. Remember what we said here about the dementia, and remember what we said about the cases of the dementia before we move into a next part in this lecture. Just remember, I will just take you back into the pages where we talk about the early stage of dementia in a quick navigation. We said here are the symptoms of the early stage of dementia: mild forgetfulness, difficulty learning, occasional disorientation, difficulty performing everyday tasks, poor judgment. But in that case also, we said in the next slides and the after slide, we call blaming others for mistakes. Still, this in the symptoms. Mood shift from a good mood into bad mood. Symptoms of depression also might be there in the early stages. Irritability and defensiveness, lack of spontaneity, passive withdrawn from unusual activities, and restlessness. And we talk about now the strategies. What are the strategies should be done by the personal support worker? We said use labels for the memories lost or the memories forgetting. A PSW should encourage the patients to use memo cards, memo randoms, alarms, pill dispenser, visitors will help in remembering to take the medications. Also, the numbers, very important emergency numbers like 911 and so on. So write it and keep it beside them on the bed table. Break tasks into small steps. Don't talk in general, just say things very slow down and frequently. And say it slow down when you say it, because they have a hard point in the cognitive dysfunction. Ask the client short questions. Ask questions frequently. Have some scores. Like I said, ask the client short questions. Don't tell the client, are you hungry and thirsty and you are tired? All this in one question. No. Are you hungry? Then repeat it. Are you hungry? Are you hungry? Are you tired? Are you tired? And repeat this question back. Have someone scores the doctor's appointments as well. And this is another point. Also, you could make a registration with the Alzheimer's societies, medic alerts, safety home registry. Also, this on the family, though, his beloved, the patient's beloved people, his family. They should discourage him of driving because he might lose his way while he's driving, poor management, and so on. So better in this case to stop driving. Client will not offer to drive the clients to a destination if needed as well. Also, we said encourage nutrition and hydration as well. The food and the fluids intakes is very important. Allow the client to verbalize through thoughts and feeling. So let him try to say what he has, because sometimes they don't find the words. They don't find the words or forget the words which they should use in such cases. Encourage meditation or stress relieving activities. Encourage the clients to stay physically fit, social connected, and with family and friends. Participate in activities that bring meaning to them. Also, let the client do the activities which can make him always safe, keep him safe. Encourage the use of safety features like handrails and grab bars. This is another point. The grab bars and the handrails as well. Remove tripping hazards from home, like we said before, scutters or whatever, cords, electric cords, the plugs, all this. Just don't put it in risk. Don't put the client in risk, because you don't know, he might be confused even in using it. And now we came to the question which we are in. Discuss the symptoms of early stages of dementia, then discuss what a personal support worker strategy should be conducted in this case, what the PSW is expected to do when dealing with a dementia case in the early stage, in the early stages of dementia, what the PSW should do, or the health caregiver. What are the things he did? I repeated here twice right now. If you want to Google search for extra points, why not? Just write it and write it down inside your notes. I'll be waiting here to collect your notes, for you guys to collect your notes for around 5 minutes before we leave into another part.